Paylocity presents the Affordable Care Act. The clock is ticking. Over the next hour, we'll be taking a detailed look at the shared responsibility provision of the Affordable Care Act, along with the review of the recently released reporting requirements for 2015 plan years. Now, as we get started, first we have a few housekeeping items. In the GoToWebinar viewer, you do have the option of full screening or zooming into the presentation to ensure that you can see everything properly. Also, please note that today's slide deck is available from your Paylocity contact if you wanted a copy for your reference. We do intend on going the full hour, and everyone is muted for the purpose of audio quality. However, if you do have a question or comment, go ahead and chat it in, and time permitting, we'll address them at the end of today's presentation. Please note that Paylocity provides this information as general guidance only. This does not constitute the provision of legal advice, tax advice, accounting services, investment advice, or professional consulting of any kind. The information provided herein should not be used as a substitute for consultation with a professional tax, accounting, legal, or other competent advisor. We'll start today by taking a look at the shared responsibility provision of the Affordable Care Act, oftentimes referred to as player pay, or the employer mandate. This is scheduled to begin enforcement with plan years beginning on or after January 1st of 2015. Note that under shared responsibility, large employers must offer an affordable health plan providing minimum value to a percentage of all full-time employees or face a penalty. Note that everything that you see in bold and in orange is really something that requires an employer to track, measure, monitor, audit, and report. We'll be going into each of these in some level of detail today. We begin by addressing the question, what exactly is a large employer? To be subject to the shared responsibility provisions of the Affordable Care Act, an employer must employ at least 50 full-time employees or a combination of full-time and part-time employees that equals at least 50. Under shared responsibility, a full-time employee is someone who averages 30 hours of service per week or more. So in an IRS example, 40 full-time employees employed 30 hours per week or more on average, plus 20 half-time employees employed 15 hours per week on average, are the equivalent of 50 full-time employees, and this is in spite of them being 60 individuals. So off the bat, we know that making this large employer determination is not as simple as simply counting heads. So when are we counting employees to make this determination? An employer will count their full-time employees and equivalents each year to know whether they are subject to this provision for the following calendar year. Employers will count their full-time employees in 2014, for example, to determine their large employer status and their compliance requirement for 2015. Now, as transition relief for 2015 compliance, an employer may make its large employer status determination based on any consecutive 6 months in 2014. So how do we actually count employees? The first thing we need to note is this is initially done on a month-by-month basis, and then we total and average the employee count for the entire year at the end of this process. We begin by first identifying how many active full-time employees were employed in each calendar month. Then we total all subject hours in that month payable to non-full-time employees, such as part-time employees, seasonal workers, and so forth. Note that subject hours include all hours paid, including worked hours, sick, vacation, bereavement, jury duty, etc. Also note, and critically, that employers only count the first 120 hours worked by each employee. So if I have a landscaping company, for example, where employees routinely work 300 hours per month in spite of not being full-time, I'm only actually counting the first 120 hours worked by any individual employee when making this determination. Those total subject hours are then divided by 120 to determine how many full-time equivalents there are. Please note that at this point we're going to hang on to any fractions and decimals that we have. We then add our full-time employees to the full-time equivalent count to determine the total employee equivalent count per month. We then sum that up for the entire year and divide by 12 to determine the average number of full-time employees per month, in this case 51.45. So this hypothetical company meets the definition of a large employer and hence is subject to the provisions that we'll be discussing in today's presentation. Please note that there are some allowances for seasonal workers. Chiefly, if an employer exceeds 50 full-time employees and equivalents for 4 or fewer months, and those months do not need to be consecutive, and the only reason they exceeded that total was due to the employment of seasonal staff, then the employer is not considered a large employer. There are certain individuals whose hours should not be counted. Now, under ACA, an employee is defined using a common law standard, so the following individuals will not count as employees for determining large employer status. Those include leased employees, sole proprietors, partners, owners, 2% shareholders that are not acting in the capacity of an employee. Also note that bona fide volunteers, as are common in the case of volunteer fire companies, are not considered employees when making this determination. So what hours don't count when making this determination? Please note that only hours worked inside the United States need to be counted for determining large employer status. So hours worked abroad, be it overseas or in a U.S. territory such as Puerto Rico or the Virgin Islands, do not need to count for making this determination. Additionally, guidance from this past March has confirmed that unpaid internship hours and hours worked by students as part of a federal work-study plan or a state equivalent do not need to be counted when making a large employer determination. The question arises, what about affiliated or controlled ownership groups? Now, if an employer is part of a group that meets the IRS test of controlled ownership, also referred to as Section 414, then the employees and full-time equivalents of all entities are counted together when determining large employer status. So in this example, let's say that David Smith owns 80% of 5 ice cream shops. Now, even if each shop only employs 30 individuals, each of the shops are still subject to the shared responsibility provision since there's common controlled ownership and their combined full-time employee and FTE count is greater than 50. Having discussed what it is to be a large employer, we also want to understand what the penalties are involved with shared responsibility compliance. Now, the final guidance phases in the penalty portion of shared responsibility based on employer size over the 2015 and 2016 plan years. Employers with fewer than 50 full-time employees and equivalents are not subject to shared responsibility and hence compliance is not required. For employers with more than 50 but fewer than 100 full-time employees and equivalents, in 2016, these employers must offer coverage to at least 95% of their full-time employees or face a penalty. In 2015, however, employers in the size bracket are subject to transition relief, which allows them to not be penalized, assuming they meet certain criteria. Please note that this is not automatic, and employers in this group, should they choose not to be penalized, are still subject to certain criteria. Let's take a look at what those are right now. Chiefly in this list are numbers 3 and 4. If a health plan is offered today, that coverage must continue to be offered. Also note that with number 4, that employers in this size bracket must still meet the ACA filing and reporting requirements that we'll be discussing later in today's presentation. Employers with more than 100 full-time employees and equivalents need to offer coverage to at least 70% of those full-time employees in 2015 and 95% of those full-time employees in 2016 to avoid a penalty. There are 2 penalties involved with shared responsibility, the first of which comes in a case where coverage is not offered to at least X% of full-time employees as described in our previous slide. That penalty is $2,000 per year for each full-time employee, which is triggered by an employee receiving a subsidy to purchase coverage at an exchange. Now, when calculating this penalty, if the employer has fewer than 100 full-time employees and equivalents, they can exclude 30 full-time employees from that penalty calculation. If they have more than 100 full-time employees and equivalents, they can exclude 80 full-time employees from that calculation. Let's take a look at 2 examples. ABC Corporation does not offer health insurance coverage and employs 110 full-time employees and equivalents, 85 of whom are full-time. In 2015, if at least one employee receives a tax credit for exchange coverage, ABC Corporation would owe $10,000. We arrive at this by taking our 85 full-time employees, and we exclude 80 of those because this particular employer has more than 100 full-time employees and equivalents, which leaves us with 5 employees and a penalty of $2,000 per head equals $10,000. In our second example, let's say that Acme LLC again does not offer health insurance and they employ 65 full-time employees and equivalents, 45 of whom are actually full-time. In 2016, assuming that they take advantage of not being penalized in 2015. In 2016, if at least one employee receives a tax credit for exchange coverage, they would owe $30,000. We arrive at that by taking 45 full-time employees, excluding 30. Again, we exclude 30 because they have fewer than 100 full-time employees and equivalents, which leaves us with 15 employees at a penalty rate of $2,000 per head, equals $30,000. The other penalty comes into play in cases where coverage is offered to at least a specific percentage of full-time employees, but that coverage is either unaffordable or does not provide minimum value. That penalty is $3,000 per year for each full-time employee that receives a subsidy for exchange coverage. Note that the chief difference between this penalty and the previous penalty is this penalty is calculated per employee that actually receives a subsidy, whereas the previous penalty, in cases where no coverage is offered, is calculated per full-time employee, regardless of whether that employee actually applied and received a subsidy. Also note that if an employer offers an affordable plan of minimum value, but the employee elects to purchase coverage at an exchange anyhow, there is no penalty to the employer. Also interesting to note is how penalties will be assessed. This process is anticipated to be similar to other notice of demand payments that the IRS issues today. Now, the reporting elements will be due in 2016, and it's anticipated that it will take several months for the IRS to reconcile employer information with information from insurers to enforce the individual mandate and the employer mandate. So in many cases, employers may find themselves in a position where in 2017 they're receiving notice of demand payments or inquiries from the IRS based on employee information that is from 2015. So here's a great example of how accurate record keeping will be paramount for accurate compliance. When we look at our definition of shared responsibility, our next element turns to affordability. Mainly, how do we define what affordability is? Personally, this is my favorite element of the ACA because it illustrates sometimes the disconnect between framing the law and practical implementation. You can imagine a conversation between legislators, bureaucrats, and employers as going something like this. The initial definition of affordability is such where a health plan is considered affordable if the cost of single coverage in the least expensive plan does not exceed 9.5% of an employee's household modified adjusted gross income. Now, employers had a legitimate concern in that they really don't know what household income is. They only know what they pay the employee, and with these substantial penalties potentially in play, there needs to be a method to accurately manage this element of shared responsibility. Based on that, a number of safe harbor options were provided to employers, and so long as employers can demonstrate good faith compliance with the safe harbor methods, they would not face a penalty. So what are these affordability safe harbor options? The affordability test still means that single coverage in an employer's least expensive plan that provides minimum essential coverage cannot exceed 9.5% of quote-unquote income. There are multiple safe harbor methods, however, to determine exactly what income is for that test. Employers can use an option of box 1 of the employee's W-2 wages for the year. They can also base their affordability safe harbor based on the federal poverty level for a single individual, which is consistent across the continental U.S. and slightly higher in Alaska and Hawaii. Employers can also elect to use a full-time equivalent wage method, whereby the lowest rate paid to an employee in a month is multiplied by 130 to determine their equivalent full-time wages for that month. Now, in early August, the IRS released new affordability guidelines in accordance with a statutory procedure that adjusts the household affordability standard to account for the fact that healthcare costs always rise faster than income growth. That changes the statutory test for affordability based on household income from 9.5% to 9.56%. There's an interesting debate, however, in legal circles since the affordability safe harbors are currently wired to 9.5% and don't reference that statutory test. As this issue is being resolved, the general guidance is to continue to use 9.5% for the affordability safe harbors, simply for the sake of it only being a 0.06% difference. One thing to note is that employers are able to apply different affordability safe harbor methods to different groups of employees. They can do so based on what are known as reasonable categories, which include things such as job categories, nature of compensation, geographic location, and other bona fide business criteria. The key thing to note here is this will need to be enforced consistently, and note that you cannot specify individual employees and assign them to a unique safe harbor method on an individual basis. There are some considerations for each safe harbor method. With respect to the Box 1 W-2 safe harbor method, it's important to note that Box 1 wages are not the same thing as gross income, as Box 1 wages are reduced by 401k and pre-tax Section 125 contributions. With respect to the hourly rate of pay safe harbor, it's key to note here that the rate of pay used in this safe harbor is the lowest rate paid to that employee in a given month. And with respect to the federal poverty level safe harbor, for administrative convenience, especially at the beginning of a new year, employers may apply a poverty level from the past 6 months for the purpose of administrative convenience. Having talked at some length about affordability, we'll next turn our attention to the concept of minimum value. So what is minimum value? Under shared responsibility, a plan is considered being a minimum value if it covers at least 60% of the total allowed cost of benefits provided, accounting for things such as copays, deductibles, coinsurance, etc. In exchange terms, this is known as a bronze plan. Now, the Department of Health and Human Services has released a minimum plan value actuarial calculator that assists employers and brokers in determining a plan's actuarial value. That looks something similar to what you see on your screen now, where users simply enter and configure their plan rules for coverage, and this will determine what that actuarial plan value might look like. It's also important to note that consultation with your broker is paramount in this issue, since they're instrumental in determining actuarial values and your plan coverage. The last element with shared responsibility that we'll turn our attention to is the one that's most vexing to almost all employers, and that's making a full-time employee determination to ensure offers of coverage are being handled properly. So how do we determine full-time status for benefit eligibility? Now, under shared responsibility, coverage must be offered to all full-time employees subject to a maximum 90-day waiting period. Employers can extend coverage to part-time employees, and they may continue to do so, but are not required. So how do we determine full-time status? Now, if an employee, by virtue of their position or in the nature of the business, is reasonably expected to work, on average, 30 hours per week or 130 hours per month, they should be classified as full-time immediately and must be offered benefits subject to that maximum 90-day waiting period. Now, if the employee is definitely not full-time, then there is no requirement to offer coverage. The issue comes in a third category, however, in cases where it's unknown whether the employee is full-time or part-time. In this case, they are known as a variable hour employee. There's a very high concentration of this employment type within retail, restaurants, hospitality, and the service sector in general, where there's wide variability in an employee's hours from week to week based on a number of business criteria. So, as we mentioned at the beginning of our presentation, an employee is considered full-time under ACA if he or she averages 30 hours of service per week in a month. Now, originally, this determination as to whether a variable hour employee was full-time was supposed to be done every month. Now, if you can imagine the administrative burden with open enrollment and then multiply that by 12, you can see that there was naturally plenty of concern about changing eligibility status every 30 days and the administrative burden that would create. An optional safe harbor method was thus created to assist employers in determining an employee's full-time status using what's known as a look-back measurement period. So what is a measurement period? A measurement period is a company-selected 3 to 12-month time frame that is used to determine whether a variable hour employee is full-time for benefit eligibility. Now, if the employee averages 30 hours per week or 130 hours per month or more within this period, they are considered full-time employees and must be offered insurance coverage. There are two types of measurement periods that we'll concern ourselves with. The first is what's known as a standard measurement period. Now, this applies to all employees in a group and begins and ends on the same date for all employees within that group. You can think of this as being analogous to an annual open enrollment for all employees. It generally happens roughly on the same date for everyone. Our next period type is known as the initial measurement period. This is applied per newly hired variable hour employee and generally coincides with the beginning of their employment. You can think of this as being analogous to a new hire's enrollment period, since that's generally tied to the employee start date. The next concept we have is that of a stability period. Now, if, based off the averaging of hours within that measurement period, they're determined to be full-time, they are eligible for benefits and that full-time status is locked in for the following stability period. Now, in a standard measurement period and an initial measurement period, the stability period is the same length as the measurement period and it can never be less than 6 months long. There's some additional nuance we'll discuss with respect to new hires in just a moment. Now, there's also an optional administrative period. This period can be up to 90 days between the measurement and the stability period, and employers can use this to determine who is eligible for coverage, to notify those employees, collect their enrollments, and enroll those employees with the carrier. Now, to prevent gaps in coverage, this administrative period must overlap with the prior stability period. Let's take a look at a few examples of measurement periods. In this first example, with a 3-month measurement period, the employee's hours are being tracked and accumulated in July, August, and September. In this example, the employer has elected a full 90-day administrative period of October, November, and December, in which they'll use to determine the employee status, and that status is then locked in for the following stability period. Similarly, with a 6-month measurement period, in this case, the hours are being tracked between April and September over that 6-month period. In this example, they've elected a 3-month administrative period to conduct the administrative tasks associated with that determination, and that employee status is then locked in as a result of that measurement period for a 6-month stability period, which is equal to that measurement period going from January through the end of June. In what is likely to be the most common scenario, in a 12-month measurement period, the employee's hours are calculated from October to the end of September, and again we have the full 90-day administrative period, and that full-time determination is then locked in for the following 12-month stability period. Note that the 12-month period is likely to be the most common option, primarily because it smooths out spikes and valleys in an employee's hours, and in many cases is advantageous to the employer, since the employer is not obligated to provide coverage within that look-back measurement period. Employers, however, are likely to manage to specific strategic objectives with respect to their benefits, and oftentimes they'll do so in consultation with their broker. For example, I've heard of employers who are using a 3-month measurement period as a recruiting tool to attract top-tier candidates by using the line that they'll be able to be eligible for benefits in as few as 3 months, whereas with their competitors it could be 12 months in some cases. Note that an employer does have the ability to have multiple measurement and stability periods for different groups of employees. The specific classifications of employees in IRS guidance include different rules for hourly versus salaried employees, different rules for union and non-union, different rules per union, different rules per state of employment, and different rules per member employer within an affiliated group. The key, of course, here is always consistency, and that all employees in the same class must be measured uniformly. There are some very specific rules for new hires with respect to their measurement and administrative period. Primarily, the initial measurement period and the administrative period together cannot extend beyond the last day of the first calendar month beginning on or after the first-year anniversary of the employee start date. It's difficult to see in words, so let's spell this out with an example. This is Denise. She was hired March 15th, which means her anniversary is the following March 15th. Because the measurement and admin period have to end by the end of the month following her anniversary, in this case that's the end of April, and her coverage and stability period begins May 1st. One thing to note here in this case, as we mentioned a moment ago, it seems like most employers who are using a measurement period are likely to pick a 12-month option. But in that case, because of this provision, employers using an 11 or 12-month measurement period are not able to use the full 90-day administrative period with new hires. They're able to do that with ongoing employees, but with new hires and specifically, they need to be aware of this particular provision. The other thing to note here is that initial and ongoing measurement periods happen simultaneously. So in our previous example, Denise was hired March 15th, so her hours are being measured March to March, in her initial measurement period, and we have a sliver of a few weeks for an admin period, and then her full-time status, be it eligible or not eligible, is locked in for that following initial stability period. Let's say also that Denise's employer has a standard measurement period, and again this is a period applied to everyone, that begins in October. So in this case there's a period of time between October and March where hours that she works are going to be counted essentially in both buckets simultaneously. And it's important to be able to manage and administer those periods individually for Denise. There's also some specific guidance with respect to new hires. Under regulations, if a variable hour employee has no creditable hours for 13 weeks, they can be treated as a new employee for purposes of determining their full-time status. Also, there's an optional rule of parity whereby a rehire can be treated as a new employee if the employee has no hours for at least 4 weeks and the length of time they went without hours is greater than the length of time they were employed. For example, if a variable hour employee worked for 3 weeks, terminates, and is then rehired by that same employer 10 weeks after terminating, that rehire can be treated as a new employee, chiefly because that 10-week gap in service is greater than that preceding 3 weeks of service. We'll now want to turn our attention to discussing the ACA reporting requirements that have been finalized in July and August of 2014. Now, the information we're reviewing today is coming from the Federal Register and also the recently released draft forms and instructions on the IRS website. So why is reporting required? Now, reporting duties are spelled out in Section 6055 and 6056 of the Internal Revenue Code. Section 6055 provides that the data required by administrators to manage the individual mandate, and again that ensures that every American is covered by an insurance plan. Section 6056 provides the data required by administrators to manage the employer mandate or shared responsibility provisions of the Affordable Care Act. So if you've ever had the question, well, how's the IRS going to know if I'm really a large employer? Section 6056 is what's going to provide them with the data needed to administer that element. If you recall, back in July of 2013, it was a lack of clear reporting guidelines and formats that delayed the implementation of the penalty phase of ACA by a year. Now that we have those and we're preparing to implement that going forward, note that reporting is now required for 2015 plan years and is then due in 2016. Reporting is, however, optional for 2014 plan years for being due in 2015. So what's filed under Section 6055 and 6056? Now, 6055 reporting is required of what are known as providers of coverage. This section will detail all the individuals covered by that provider and which months in the calendar year they were covered. This information is crucial to the IRS to administer the individual mandate. Note that providers of coverage include private insurers such as Blue Cross Blue Shield, your Kaisers, Anthems, United Healthcares, etc. And these also comprise public programs such as VA coverage, Medicare, Medicaid, S-CHIP programs, and so forth. Also note, however, that employers that self-insure are also considered for this purpose providers of coverage and are subject to this section's reporting requirement. Note that employers that do not self-insure are not subject to this requirement. Now, for the purpose of convenience to employers that do self-insure, the information that's required under this section can be combined with the reporting that's required of all employers under Section 6056. Section 6056 reporting has a number of objectives. It's going to provide the IRS with the data needed to administer the shared responsibility provisions of the Affordable Care Act, including employee counts and so forth. It'll provide employees with new data needed to determine their eligibility for premium tax credits when purchasing exchange coverage and completing their personal tax returns each year. And again, under this section, employers who self-insure can lump in information otherwise required in Section 6055 reporting within this section to employees. Section 6056 introduces two new tax forms to the employer. The first is the 1095-C. This is a new document that the employer must issue to the employee and file with the IRS, outlining details of the coverage offered by the employer, such as who is covered, is it affordable, is it of minimum value, and so forth, and the status of the employer's offer of coverage to that employee on a month-by-month basis. This document is unique to each employee, just like a W-2 is. It must be furnished to each employee by January 31st for the previous year, just like the W-2, And just like the W-2, employers issuing more than 250 1095-Cs must file their IRS copies electronically. Note that this last requirement is based on the number of forms and not the number of employees. So a employer with 125 employees that has 100% turnover would be issuing 250 forms and would be subject to this last requirement. The next form is known as the 1094-C. This is also called the transmittal. It essentially sums up the information on the individual 1095-Cs, much like the W-3 is a transmittal of the form W-2. And it also provides employer-specific details such as the number of full-time employees, total employees per month, and whether the employer is electing to take advantage of other relief criteria. This filing is due to the IRS by March 31st for the previous year's information. The next question that comes up is, well, who must file? The key thing to note here is that all applicable large employers, and again, that definition is 50 or more full-time employees and equivalents on average within each calendar month for the previous calendar year, must file Forms 1094-C and 1095-C. And this must be done regardless of whether the employer offers coverage or not. Also note that in the case of employers that have between 50 and 100 full-time employees and equivalents that would otherwise not be penalized for 2015, these employers still need to file and indicate that they want to take advantage of that transition relief. That transition relief is not automatic. Let's take a look at the draft form. The forms we're looking at are known as the general method of reporting. There are very specific other options for employers to take advantage of. However, we're not going to be covering those on today's webinar as they have a lot of niche scenarios, such as needing a different method for employees, for example, that were not employed for all 12 months in the calendar year. As I don't know too many employers that have never hired or fired anyone over the course of a full calendar year, we're going to take a look at the most general method available, which are Forms 1094-C and 1095-C. Now, Form 1095-C is broken up into three different sections. Part 1 is essentially identifying information for the employee and the employer. Nothing earth-shattering here. Name, address, and SOCH for the employee. Name, address, EIN, and a contact number for the employer. The key elements of Form 1095-C come in our next three lines. Line 14 is the offer of coverage code. This is what identifies if for a calendar month there was an offer of coverage, and if so, whether that coverage was affordable, provided minimum essential coverage, and whether that coverage is for employees only or is also available to spouses and or dependents. Line 15 indicates the monthly plan premium for single coverage in the least expensive plan that provides a minimum essential coverage within each month. This is akin to the Safe Harbor plan premium with our Affordability Safe Harbor options. Line 16 indicates specific Safe Harbor elections that an employer is making with respect to that employee within a calendar month. So, for example, if I were hired in June, Form 1095-C needs information for all 12 calendar months, even though I was hired mid-year. So in that case, my January through May boxes would show that I was not offered coverage in line 14, and in line 16 it would say, well, I wasn't offered coverage because I wasn't employed. This will also be where an employer will indicate specific affordability safe harbors that they've elected for individual months. Part 3 is where we bring in information required of self-insured companies. This is where we indicate who was actually covered, so not whether coverage was offered, but who was actually covered, their name, and what will likely be best off being their social security number. Let's take a look at Form 1094-C now. This one's a slightly longer return at 3 pages. On page 1 of the transmittal, we have identifying information for the employer. Again, name, address, EIN number, and so forth, and a total count of 1095-Cs associated with this transmittal. Part 2 is where we identify whether this employer is part of a group, so the IRS knows to reconcile multiple companies together simultaneously. Line 22, as I mentioned earlier, there are some specific alternative reporting methods that are available to employers based on how they offer coverage. Employers can elect to take advantage of certain options in that regard on line 22. The second page of the return is our applicable large employer member information on a month-by-month basis. This will indicate for each month the number of full-time and total employees for each applicable large employer group member. On this form, note that column E, labeled Section 4980H Transition Relief Indicator, this is a column that employers with more than 50 but fewer than 100 full-time employees and equivalents will indicate that they want to avail themselves of transition relief to not be penalized for 2015 calendar years. The third page of the return is specific for employers that are a member of an applicable large employer group. And on this page, the employer will indicate the other entities they're affiliated with, including their name and their EIN. Having taken a look at the draft return copies, we want to take a few minutes to take a look at Paylocity's compliance tools for ACA. And it's important to note that these compliance tools come standard. Everything that we'll see does not require the purchase of an additional module other than basic payroll. The intention behind this is to really enable an employer to have very strategic conversations with their broker. For example, that first conversation would be, well, am I even a large employer? On the standard ACA FTE Count Report, employers can see the determination of that calculation on a month-by-month basis, and can also be broken out by employment type. So with respect to the seasonal exception, if that's an employment type, that can be broken out to determine whether that exception applies, in which case the employer may elect to not be considered a large employer. On the standard ACA Compliance Dashboard with Paylocity, there's a standard FTE count widget, which will indicate the number of full-time employees and equivalents per month, with that line representing 50, to easily determine what the trends and patterns of employment look like. With respect to making a full-time employee determination, there's a number of tools available to determine who should be benefit eligible. On the standard ACA Hours Analysis Report, the user can sort and filter on a range of demographic data points, including IDs, names, employment types, cost center, position, pay type, work state, and so forth. On this report, we'll automatically calculate the average hours per week and per month, and the variance off that full-time standard. This eligibility information is also presented in context of age. So for employers that see, wow, I've got a lot of employees that are eligible, but then see that, a lot of them are under 26 or over 65, in this case, this may shift the nature of conversation they'll have with those employees to discuss other coverage options available to them aside from the employer's plan. When running this report, employers can filter for employers who are currently averaging between a certain range of hours. So when generating this report, they can say, I only want to see people averaging between 28 and 31 hours. So instead of seeing 800 employees, they might see the 25 employees that are within that range that may need to be actively scheduled toward a particular objective. On the ACA Compliance Dashboard, we configure a number of rules with respect to that measurement period, including the length and beginning time of that measurement period, the nature of the administrative period. Note that we'll account for the specific rules for new hires and their initial administrative period as well. We'll also ensure that the stability period rules are enforced, requiring that the stability period be at least as long as the measurement period. On the eligibility dashboard, we'll see the eligibility for variable hour employees based on actual hours worked. And a number of filters can be used to easily determine which employees should be full-time based on hours worked that are not currently classified as such. These would be exceptions that will likely need some attention. As with all ACA reports, this data can be exported for further analysis. When looking at the employee record within the ACA module, note that initial and standard measurement periods are tracked and measured simultaneously, so there's no manual effort needed to move an employee's hours from one bucket to another when that anniversary period crosses. Also note that you have the ability to see a detailed history of recorded hours without having to run any reports right on the employee screen. With respect to our last question around managing affordability, we provide a similar number of tools. The ACA Plan Affordability Report is similar to the Hours Analysis Report in that it provides the same relevant demographic data points. The key thing on this report is it models affordability against all three safe harbor options simultaneously. Column U being the W-2 safe harbor method, column W being the rate of pay safe harbor method, and column Y being the federal poverty level safe harbor method. This affordability information is again presented in context of not only age, but also of income. So in column T, for example, an employer may be able to use this data to ballpark eligibility for programs such as Medicaid, and again, shape the nature of that conversation with that employee toward being which coverage types is that employee eligible for, be it from the employer or other sources. And on this report, for each safe harbor method, we'll see a count of non-compliant employees by method. When running this report, this is a great modeling tool, so as plan premiums change, you can model this on the report and see what effect that plan premium would have based on actual historical employment data. So you can see the impact on affordability of raising premiums, for example. On the affordability tool set, again, we'll configure what that safe harbor monthly plan premium looks like. This will drive the default on that report as well. We're also able to visualize all three safe harbor methods on the chart, including data points such as the employee's age and what the affordability percentage is for each method. And again, just like the hours analysis dashboard, this one could be filtered for very specific employee scenarios as well. We do have a number of upcoming enhancements in our next several releases. These include enhancements to track, pre-populate, and file Forms 1095-C and 1094-C on behalf of employers. We'll also be introducing improved rehire and variable hour employee support and support for leaves of absences, and also offer a framework to offer notices of coverage and alerts and reminders around ACA workflow. At Paylocity, it's our mission to elevate the profession of payroll and human resources out of the back office and into the boardroom, and we do so by providing value-added tools such as our ACA Compliance Toolkit that allow these practitioners to be essential partners in their business's success.